We'd like to thank you for joining us today. A few housekeeping reminders for the good of the order, since we're all joining virtually. Given the bandwidth, we want to just make sure that if you are not presenting, we may not need you to be on camera, so you're welcome to turn off your cameras. That's one. Secondly, if you are not presenting, or it's not during the Q&A, we ask that you keep your mics muted, and we will get started. I believe the first voice that you'll hear from after mine is our Executive Director, Mr. Kai D. Menser. He's been with Atlanta VA Healthcare System since June of this year. And I know that he and the ELT are going to provide some verbal updates, and then we have some slides. As we previously committed, we are moving away from lengthy presentations, and we'll have more Q&A so that our veterans, caregivers, family members, and stakeholders can ask questions of our staff. Now, I will also add, before we get too far underway, that due to the recent hurricane, a lot of our team members may not be on the call. So we apologize in advance, but we will commit to connecting you with folks as needed. So we will be keeping an eye on the chat. A few members from our public affairs team are on today. We'll keep an eye on the chat, and we will make sure that we get you connected with folks as the day goes on. I did also add the patient advocate number in the chat. It's also on one of the slides, so you will see that near the end before we move to the Q&A. We'll have some upcoming events that we'd like to share with you, as well as move to the Q&A. So without further ado, I can't see everything because I have limited connectivity right now today, but if Mr. Menser is on, I believe we could move to the next slide and he can provide his update. Thank you.
Yes, ma'am. Good afternoon, everyone. Thanks, Ms. Cook. Appreciate you, ensuring that this happened today, even with the hurricane and the impacts from the storm, and two, working with your team to get this done for the veterans so that we didn't have to reschedule or move this around. So a couple things that I wanted to share. My team gave me 1, 2, 3 pages of notes. I don't think that's what you guys want to hear, so I'm going to share some of the important things to me as a leader, where I see this VA heading on this journey with me at the helm while I get the opportunity to carry the torch, and what I think you can expect, because it's what I would expect as a veteran. So first of all, it's important to me that we improve our experience here in Atlanta. That's going to take some time, and it's going to take some partnerships with you all that are here to let us know how we're doing, ask the questions that help me better understand what your care is like. I get my care here, but I recognize that my care might be different because people know who I am now that I've been here for a few months. So that first thing is improving the employee and the veteran experience. I know that a happy employee can lead to happy veterans. Now, that's not always the case. There's certainly a handful of veterans out there. I know some of them are my friends that will never be satisfied with anything. But I also know that it's unlikely for our veterans to be satisfied if our staff aren't happy to come to work here. And so one of my accountability metrics is ensuring that the staff that are hired want to be here. In fact, I tell them that if they can't come to work and be 100%, please don't come to work. Please take that time off to take care of yourself so that you can. Second thing that's important to me is maximizing our stakeholder relationships. So one of those is being more presentable to the veterans, being out into the public at the events. For me, it's spending time in our clinics and in the community, emphasizing the importance of the relationships that we have. So last Friday, I got to spend the afternoon with Senator Ossoff. I've got another congressional meeting coming up next week. Those are stakeholders of ours. And last month, I was able to spend some time with the Warrior Alliance and about 100 VSOs and share with them kind of my vision for the VA hospital. The next one is the ability to increase access to resource for our veterans. Atlanta is a proud community for veterans, and I think we need to capitalize on that in providing what resources are available to you all as veterans and share that regularly through our communications department. The third one is advocacy for our veterans and aligning the priorities that we have as veterans with what the VA has. So as a veteran, a service-connected veteran that gets care here, I can see from the veteran's perspective how the VA's way sometimes doesn't make sense. And so I see my role as a, somewhat of a translator sometimes in why the VA is doing it the way they're doing it. And more importantly, what congressional laws and mandates we have that are requiring us to do things certain ways. Then there's the obvious, and for like veterans and for the leaders in the room, I want my leaders. In fact, I need my leaders to lead by example. So you can't be that kind of leader that expects your staff to come to work and be happy if you're not going to come to work and be happy. And that's reciprocated. As a veteran, I expect people to be kind to me, to give me the care when I need it, and to make me feel better. It's pretty simple as a veteran. As a leader, I expect that from the veterans as well. I expect you to be kind to me, and I expect you to understand where I'm coming from as a caregiver, and I expect there to be respect in that relationship. The last two, or the last one, I'm sorry, is providing opportunities for engagement. I am an extremely transparent leader. Sometimes I find myself in trouble by responding to just about every message that I get or every phone call. My leaders, where I find myself in trouble is my leaders want to be able to do that. And so I've started to shift a little bit of that focus to say, hey, the one person that I'll call is Frank. Frank Call, I can see he's got his camera on, so I can use his name. Frank's will maybe email me and say, hey, I've got an issue. Here's what's going on. What I'll do now is I'll email you back and I'll add the person that I know is responsible for it. And I'll say, here is, Chanel Cook. She's responsible for this. Please let me know if she doesn't follow up with you in a timely manner for you. And what I've seen is some progress and some success with that. It lets Chanel know that, I'm not going to respond for her because she's the expert. It lets you know as a veteran that Chanel is the point of contact. More times than not, I find that I'm not good at clinical. I'm not a clinician. Starting the VA as a housekeeper, and so I make sure to stay in my lane when it comes to making clinical decisions. The last thing I'll share with you all is that we are significantly growing. You know this. I see the Facebook memes and the social media and all the jokes across the country. Atlanta is a growing geographical part of the country. And we're seeing that with our veterans. We're seeing about 10% growth every year. So what that means is now we're up to almost 200,000 patients that we're caring for. It makes Atlanta a very large organization where we have been unable to grow with an infrastructure to sustain that. And so we are sending a good number of our veterans out to the community to get care when it's appropriate. We do have plans in place to rebuild the infrastructure here in Atlanta, as well as build additional space in the community. So one of my commitments to the staff here is to let them know when that happens and what that timeline looks like. And one of my commitments is to share that information on town halls so that you all know what we're doing as well. And two big things coming up for us. One of them is a feasibility study. A contracted group will come to the facility to let us know where we're at with the infrastructure we have, what they recommend we move, and where they recommend we move. So a lot of community hospitals are able to pivot more quickly with their moves and building infrastructure in the community. We follow a very tight federal process, which takes a little bit longer. So that's one of the bigger things is we're going to bring in the contractor. And then the second thing we're looking at doing is growing some of our clinics in the community with some specialty care. So we've got a mammogram clinical infrastructure restructuring occurring at one of our clinics now, where we'll be able to, for the first time, be able to provide mammograms to our fastest growing population, female veterans here. And so just a couple of the infrastructure things that we're working on, but absolutely, certainly more to. With that, I'll turn it back over to you, Chanel. I think we're going to go through our leadership team, and they're going to share some information.
Yes, sir, that's correct. Thank you, Mr. Menser. Next, we're going to hear from Miss Levita Ford. She is our Deputy Executive Director, and she'll provide a couple of verbal updates. Miss Ford?
Hi, good afternoon, everybody. Yes, it is afternoon. I have to check sometimes. I don't really have a lot more to offer other than what Mr. Mincher says. We have a lot of our committed employees that actually came in, regardless of the fact that there is actual hurricane warning. So kudos to them for coming in to make sure that we had assistance for any of the veterans that happened to come in and needed some assistance in our facility. Other than that, I hope everyone has a safe weekend, and I will turn it back over to you, Miss Cook.
Yes, ma'am. Thank you for that. Safety is the priority, so we thank everyone for being safe and hunkering down as you need to. Next, we're going to hear from Dr. Robert Norvell. He is our Chief of Staff. He has been with the Atlanta VA, I believe, since July of 2022, and he is going to talk to us about being a high reliability organization and provide a safety story. Dr. Norvell?
Hey, thank you, Ms. Cook. And so, first of all, other than being a high reliability organization, I did want to discuss some of the things that we do here at the VA. So the VA has the mission of not only providing healthcare to our nation's heroes, but also to be one of the premier educators. So we have education, healthcare. We also have research, and we have emergency management. So whenever we have any kind of bad things that happen in the community, the VA is part of our emergency response, and we have things that we keep on site to work with emergency management. So we do healthcare, we do research, we do education of our future healthcare delivery personnel. That's doctors, nurses, pharmacists, and all. And we do emergency management. In order to make all that work, we need to have something called a high reliability organization. And that's an organization that has a focus on the culture of safety, that the leaders are committed to that culture of safety, and that we have continuous process improvement. And because we're focused on a culture of safety, when I do these, I like to talk about some of the things that we have done and we continue to do to make sure that the care we provide is safe and that leadership looks at that care and that we continually improve. The last time I was here, I told a story about a patient that I got a CT scan on the weekend and that the tech noticed a pulmonary embolus or blood clot. Today, I wanted to talk about falls. So next slide, please. So this safety story talks about falls in hospitals because every year the Veterans Health Administration requires that hospitals investigate all the patient falls that occurred at the Veterans Health Administration locations. And we try to identify any of the root causes to have to try to prevent recurrence of one or more types of falls. And falls during a hospitalization can lead to serious injuries and further complicate care being provided to other or other illnesses. Next slide. One of the things that we did when we looked at our falls was we had a team of subject matter experts get together and they examined the hundreds of falls which occurred at the Atlanta VA healthcare system during FY23. And then the team chose to focus on causes of patients' falls on our inpatient units. So when I said the hundreds of falls, they're not just the falls that happen in the hospital, but at the nursing home, at our other 23 sites of care, or maybe even at the nursing homes. I don't know if you all know, but even our contracted nursing homes where we send our veterans, we hear about falls, and those falls can lead to a lot of other things, like we said, that can impact the care. The team discovered that many patients that fell while their families and visitors were in the room with them, and then many times the visitors are unaware of how the veteran's current illness affects the ability to walk. Because when you're in the hospital, you may not be at your best, and then this would make you more prone to falling. They also found that the fall prevention interventions that were not consistently applied. And we have things like bed alarms. We have these yellow non-skid socks. We have armbands that let people know that people may be high risk for falls. The nurses actually do a fall assessment when you come in. So the team developed action items to address the causes of our inpatient falls. And then these action items were rolled out on all of our acute care inpatient units because we're focused on the inpatient so that veterans are more prepared to not fall when they're in the inpatient. Next slide, please. The result of this continuous process and culture of safety was that the acute care nursing teams have exceeded the goal that they set for themselves, which was to decrease the falls in our inpatient unit by 10%. There were a total of about 90 patient falls on the acute care inpatient units from Q1 to 3 of FY23. And the number of falls during that same period in FY24 was lower at 74, which was almost a 20% reduction. And of course, as we said, this is about a safety culture. The next slide will actually tell you exactly how we are operating as a high reliability organization. Because from these values, we learned, we inquired, and we improved the care. We continued to support a culture of safety. We tried to commit to zero harm, and it's about the veteran. By doing this, we had a preoccupation with failure, which means we anticipate the risk and try to keep a laser sharp focus on it and then catch those errors. A sensitivity to operations, which means that the frontline staff are empowered to provide that care and make those decisions and those changes. Reluctance to simplify, which means getting to the root cause of a problem rather than settling for the simple explanations. And then a commitment to resilience. Continue to bounce back, continue to look, and continue to learn, inquire, and improve. So, we talk about all of the things that Mr. Mensah was saying, how we're growing, but we also, as you can see, are focused on safety, being the best provider of healthcare, continuing to educate the future providers of healthcare, to also look at how we can do things better through research, and then also working with the community with our emergency response. And I'd like to thank you all for giving me the time to go over some of our safety and continuous process improvements here at the Atlanta VA. Thank you, Ms. Cook.
Thank you for your leadership, Dr. Norvell, and for sharing what HRO means and why it's important for veterans and our team members. Next, we're going to hear from Dr. Connie Hampton. She is our ADPCS, and she's providing some updates. Dr. Hampton?
Thank you so much, Ms. Cook, for allowing me the opportunity to speak to our veterans. So we are excited in nursing services as we most recently won an award, and the award was for our remote patient monitoring home telehealth team. We were recognized by the National Office of Connected Care and Connected Care Distinguished Leader Award because we did so well. We're really proud of this because this is how we communicate with some of our veterans who can't necessarily get into the clinic. And what our team did was we actually utilized what's called My Images, the My VA Images program, which is an opportunity for our veterans to take pictures and actually allow for our telehealth team to reach out to the veterans and see them and then actually help them with some of the things that they have going on in their home so we can better assist to ensure their safety and make sure that they are receiving outstanding care. So I'd like to recognize my team, and for those veterans who utilize our telehealth technology, I want to say thank you to you all for allowing us the opportunity to provide this service to you. Secondly, when you come to our facility, you will notice there's employees who will wear jerseys, football jerseys that actually have what's called sepsis, a sepsis jersey, and you'll see the word CRUSH and you'll see the number 33. The CRUSH 33 process is a new code that we put in place here, code meaning to give a higher level of care when a veteran becomes sick for a particular condition. The condition that we are focusing on is sepsis. And as you can see on the presentation, the burden of sepsis is high, and it says over 1.7 million adults have different cases of sepsis all over the United States. It is truly a medical emergency. And so in April of this year, we decided that it was important for us to ensure that when our veterans come in, if they are sick from some sort of a bacteria or some type of an infection where their blood pressures drop extremely low, they have a need for IV fluids or an antibiotic, and blood work indicates that they need a higher level of care, you will hear in our hospital, you will hear CRUSH 33. They'll call it CRUSH 33. Code CRUSH 33, letting everyone in the hospital to know, let them know that we have a veteran who is in dire need of some health care. What happens is we have a team that's dedicated to go to different units and different places in the hospital to actually render just-in-time care to ensure that the blood work is done as well as make sure our patient gets to a higher level of care. And so we're really excited about this opportunity. We are the first in the country to come up with such a code, and it was actually put together and implemented by one of our nursing leaders here at the VA facility. So just in case you hear that code being called, just know that that's a call for help, similar to what you guys would have probably done when you were in battle. Lastly, we would like to talk to you a little bit about completing the survey. We know a number of you come to our facility, and we want to make sure that when you come to our facility, as Mr. Messer has told you guys, we want to hear from you. And so once you leave our facility, a survey is usually sent to your home or sent to you to let you know that we want you to give us your feedback. We are in dire need of your feedback so that we can know exactly how we can help you receive better care, or how we can improve our organization to make sure that it's the organization we want it to be. So the survey is called the Survey of Healthcare Experience of Patients, also known as the SHEP survey. So please, we're asking for your support. If you can complete those surveys and let us know exactly what your experience was, because your experience is important to us. And we welcome the opportunity to address all of the concerns. With that being said, I'd like to say thank you so much for allowing Nursing Services to speak to you all briefly. As Nursing Services, we are committed to make sure that our veterans are truly our true north. Thank you. Thank you, Ms. Cook.
Thank you for those pertinent updates, Dr. Hampton, and to the veterans and our staff who are joining us right now. You will hear more about the Crush 33 event that's on Monday in the upcoming events slide deck. Let's move on to the next slide. I do not believe that Mr. Sellers is presenting today. All right, next we'll hear from Dr. Isaac Diaguero. He is our Interim Associate Director B, which means that he is responsible for providing oversight for all of our outlying sites of care. And if you tuned in either to the news or you received the Atlanta VA Healthcare Systems newsletter, you'll note that the outlying sites of care are closed today due to the hurricane. We wanted to keep veterans and staff safe. So Dr. Diaguero, your updates are next, sir. Thank you.
All right, thank you, Chanel. Good afternoon, everyone. As the Associate Director of Outlying Sites of Care, I'm also in charge of several of our scheduling services. And I wanted to talk about some strides that we have made lately to improve our experience with scheduling appointments. It was brought to our attention that veterans were experiencing a great deal of trouble with unanswered phone calls, essentially calling a number and being routed to a phone that's either in the wrong area or not having the phone answered at all. To combat these issues, we've developed and opened up a new patient scheduling center. This center is designed to improve our system in a variety of ways. It is the first way is to implement a forward-facing phone process for all employees. We want you to connect to people and to talk to an actual human as quickly as possible so that we can recognize your needs and ensure we are connecting to the proper team. Secondly, we're almost done finalizing a plan to monitor call operations as it relates to incoming phone calls. We want to ensure that the call was answered quickly, routed correctly, completed successfully, and that the proper amount of time has been allocated to meet your needs. Most importantly, that it's a fruitful and positive experience. Third, we want to review all extensions to ensure proper routing. Essentially, we want to route these calls to the proper direction and to ensure that we're connecting you to the right people and not the wrong area or sent to a constantly ringing phone. Lastly, we're going to complete a review of all service phone requirements to ensure proper support. When something changes and inadvertently breaks, we are working to ensure that it's recognized, rerouted, and fixed as soon as possible. Now, these are just a few of the improvements that we're making regarding the phone system at the Atlanta VA. We're constantly working to improve systems and the overall veteran experience. We're definitely open to criticism, and I look forward to hearing your concerns. With that, I'll turn it back to you, Ms. Cook. Thank you.
Thank you, sir. We can go to the next slide. That was left intentionally blank, so I would remember to tell you about some upcoming events. VA is excited to partner with the Warrior Alliance and the Georgia Department of Veterans Service. We have a great, huge undertaking of an event happening next Monday. You can see the information here on your screen. Those who subscribe to our newsletter also received this information earlier this week. The team has been prepping for a few months now, and folks are extremely excited to present to veterans, family members, and caregivers all the vast array of resources, education materials, and housing assistance information to our veteran community here in Atlanta. So if you're not aware, please take note of this, either screen clip. We'll also add the link to the event in the chat once the meeting concludes so that you have that information. So please join if you are able. It is free. There's free parking and it is open to the public. You don't have to register, but it is encouraged if you'd RSVP, just so they have a general idea about how many folks will be attending the event. So again, we look forward to you joining our community partners on Monday. We can move to the next slide, please. The next event is the one that Dr. Hampton was speaking about, the Crush 33 Sepsis Awareness Month event. It is next Monday from 1 to 2 o'clock at the Pete Wheeler Auditorium, which is located at our main facility, the Joseph Maxwell Cleland Atlanta VA Medical Center. They are super excited. We're excited. They've been advertising their jerseys to the team and really want to just impart the importance of this excellent initiative to our veterans and to our community at large. So please come on out, join nursing leadership and VA leadership for this celebration and really an educational moment. It's really important for all of us to understand what really happens when a Crush 33 is called. We can move to the next slide. One of our chaplains, Chaplain Olga Westfall, has worked tirelessly to bring this amazingly talented group of individuals called Cultural Forces to us at the Atlanta VA, and it's coming up real quick in the next couple of days on October 2nd. There will be two opportunities to hear from them. The first is a live performance at the entrance at our main facility located on Claremont Road in Decatur. And then the second opportunity is the same day in our chapel. And for those of you who are not familiar, they are outstanding. And their stories are heartwarming and also very, very reflective of the times that we're living in. And so we really thank Chaplain Westfall for putting this together and the support from our Chief Chaplain, Reginald Cleaver, for allowing this to happen. So please share this information. Don't miss this wonderful event. We can move to the next slide, please. I believe this is the last event that we are sharing. It is the We Care Vet Fair. It will happen on Saturday, October 5th at Ebenezer Baptist Church located in Atlanta. The registration is not required for this either. And it really is an opportunity for veterans to truly hear from the community, from our community partners, all of the veteran service organizations, VA, anyone who serves veterans will pretty much be there just like on Monday. So if you can't be there Monday, we ask that you try to commit to coming on Saturday, October 5th. It's going to be an extravaganza, and we really want veterans to come out and learn about what's available. We know that you often get inundated with information, but nothing can replace human contact. So if you can make it to one or all of these events, we really encourage you to do so. And I believe the next slide is really the contact information for the, oh, it's not there. I'll put it in the chat like I did earlier. It was the phone number for our patient advocates. Our Chief Veteran Experience Officer is Miss Angeline McCrory, and she oversees the patient advocates that I know many of our veterans who attend our town halls have had the pleasure of interacting with her staff, sharing compliments and concerns, and making sure that we have an opportunity to provide service recovery. So without further ado, this is the opportunity for our staff and leadership team to hear directly from veterans. And unfortunately, I can't see you all in person. And so I'm going to do my best to take a look at the chat, see if folks have their hands up. We ask that you extend grace to us, and we'll extend it back to you as we work through this new normal established as a result of Hurricane Helene. All right, I see one hand up. I cannot pronounce the name. I'm going to try to go in order as best I can, but the initials are K and O. So if you would like to come off mute and ask your question, the main caveat that we ask folks is to remember not to overshare any personal patient healthcare information or any identifiers, because we do live in a digital age and we want to do our best to protect your privacy. So if you could speak in some general terms, that would be appreciated. KO, you're free to speak.
Thank you very much. My name is Kitefra Oboho. I'm one of the staff physicians with the VA, and I really appreciate this forum where we talk about all the things we can do to help promote the health of our veterans. But at the same time, I really want to bring to the attention of the director that it seems as if those of us who are taking care of the veterans are being left out. As a physician, I know I'm retiring in the next 2-3 years. Hello, somebody muted me.
No, you're still, we can still hear you, sir.
Okay. In the past 4 years, the VA physicians have not had any biannual evaluation done for their salaries. More so, in January of this year, the secretary approved a new salary structure for the VA veterans that should take effect from January of this year. Up till now, none of that has been implemented by the VA, despite all communications with our leadership. I don't know how we can behave like this and feel bad when providers are leaving the VA. So I would appreciate very much if we can get an idea when this will be implemented for the VA physicians. Thank you.
Thank you, sir. Do we have a member of the leadership team who is equipped to speak to that, or would we like to offer?
Well, I will add more insight here. This had come up before, and the chief of staff said he was not aware of it and asked me to send all the information to him, which I did months ago. Despite many communications, emails, and he has not responded. I think Dr. Novell is on, so I would appreciate if he can answer this for us.
Hey, Dr. Sifri Oboho. First of all, thanks for speaking up. The challenge for me is that the intended audience for the town hall would be our veterans, our customers. I know Dr. Norvell is on the call. And so we could probably follow up with you separately. I don't want to take up the time for our veterans to address employee issues. We'll have our employee town hall, I think it's next month or the month after. Is that right, Chanel?
Yes, sir. We'll make sure that the announcement goes out to all staff for the town hall as well.
Thank you.
That's
so separately, we'll follow up with you, Dr. Iboho. Yeah, thank you for bringing it up, Bill. I know Dr. Norvell was. I see him already here. I wanted to.
Okay.
Thanks.
Okay, the next hand that I saw up was with the initial L. I believe it says Lieutenant Colonel Willie Turner. Mr. Turner? Mr. Turner, are you still with us? He's right. We'll see if we can get Mr. Turner back. Next, I see Gia Gillies or Gillies.
Good afternoon. Good afternoon. I am with Disabled American Veterans Auxiliary, and I'm calling and I'm here and listening, and I'm so thankful for your town hall. I'm really speaking out for the Vietnam veterans. They have no more group meetings. A lot of those veterans are, some have wives, others have caregivers, and there are a lot of them who are just single without. If they have no group meetings, how will they be able to reach out if they need help? They're just going to kind of be trickled away, or they're going to fall away, and they're going to stay in corners to themselves. Is there any way, because I just came from a luncheon and there's a few groups who are no longer meeting, even if it's Zoom, is there any way that that can be resumed? Is there an opportunity for a new set of doctors to come on board and facilitate a Zoom meeting for the veterans? I mean, for the Vietnam veterans?
Asking for leadership if there is someone who is able to answer her question.
So the first question I have, or were these in person? Because the last meeting I went to, we talked about in-person meetings, and are they led by peer support is the first question that I wanted to make sure that I'm understanding.
No, these are Zoom calls. A lot of the Vietnam veterans are, they're elderly now, and so they can't keep coming back and forth to the hospital, but they are doing more Zoom and more, on phone conversations, teleconversations.
All right, because this is similar to one. We actually had one where they asked for more face-to-face meetings and groups.
Yes,
and so
sir.
we actually implemented some face-to-face. I was not aware of the Zoom and that our Vietnam veterans, because I actually at the last town hall stayed behind and talked to, and they asked me about the face-to-face, which we implemented with our mental health group. But I'll have to take the Zoom meetings back to mental health and discuss that with them, because the last ask I had was for more face-to-face meetings with the Vietnam veterans and not the Zoom calls, but that is something that we can take back. Thank you for that.
Thank you.
All right, it looks like Mr. Turner is back and available. Mr. Turner, did you have a question?
Can you hear me?
We can hear you, but it is a little bit muffled, sir. But yes, we can hear you nonetheless.
Okay, I'm gonna try to make this quick. My question is to the new director. Is it your intent to hold town hall meetings via Zoom?
No, it's a great question. My intent is to do them in person. And it's like the team, they said, let's do this virtually on Friday. And I said, in my mind, I'd rather cancel it than do it virtually. But the challenges are that I want to be available. And so given the hurricane and given the challenges, we thought we'd best do it virtually than not do it at all. So I'd like to get, in front of each of you, have the time to shake your hands, thank you for your service, and make it a person-to-person conversation.
Yes, because I was a little disappointed you being the director and you being on board for a while and not having the opportunity to come in and do a town hall and speak to you. I think Zooms are very impersonal, and as a new director, I just thought that it was wasn't well prepared. I do have one other question though.
I agree, sir. I think with the hurricane, right, which really was one of the faster ones I think I've seen in a while. I was disappointed that we weren't going to be in person. So I agree with you, incessantly.
My next question, this is the last one, on September 30th. I do a lot of working. Well, I work downtown, my nonprofit organization, and that is to help homeless veterans, bring a lot of them up to the hospital that are living on the streets that don't want the assistance of the VA. And it takes me a while to get them to the point that they trust me, so they'll come up to the VA to get themselves re-enrolled, if you want to say. My question to you is on the 30th.
there's going to be this event downtown. Do you have some place where you can accommodate these individuals? Because they're going to be coming off the street and they may not be smelling the best, but I want them to definitely hear and get the assistance that they need.
How ironic. How ironic, right? That last minute I had to change the town hall to virtual, and it sounds like we have a last minute request for some support. Of course, we can help. You'll have to give us some specifics, not me specifically. Is it Turner? I think she said. Maybe our social work team, maybe our homeless program can help support. I guess the quantity of veterans, the exact specific need, and appreciate your support in bringing it up and letting us know.
Sir, if I could interject here, Ms. Ramos, our chief of CDCE, may also be able to provide some sort of reprieve or, additional resources that day as well. I think CDCE is supporting that event, but I don't want to misspeak. So we'll get some details and make sure that we have that available.
Thanks, Ms. Buck. Also, a great idea. Thank you. Lisa Turner, Mr. Turner.
I apologize if I'm able to just speak up for a moment. I wrote in the chat that I work in the homeless program, healthcare for homeless veterans. I put my phone number and my email address in the chat, and if the caller, I don't know if you're able to access the chat to provide your contact information. I would definitely like to contact you and connect with you to provide assistance. We do outreach. Unfortunately, our homeless program staff won't be at the event on Monday because we didn't receive enough notice, but we do attend a lot of the events and would love to connect with you to provide resources.
Outstanding. Thank you for that. And I do believe that all of the guests have access to the chat, and we can make sure that, the information is copied and pasted as needed. But yes, Veteran Turner has attended many of our town halls since I came on board last year. And so we will make sure that he gets the information. I did see another guest. It says meeting guest external. It doesn't show a name. So if you would like to provide your question, we'll see if we can answer it to the best of our ability.
Yes, I think that might be me. Oh, I'm sorry.
Hello. Good afternoon.
Yes.
My name is Frank Call, and this question is going directly to when you were speaking about the phone call system. This is what caused me to be on this town hall. When I tried to call for my typical therapy appointment, no one picked up the phones. I called the supervisor's office, no one picked up the phone. I was about to be in trouble, so I called Ms. Gwen and she directed me what I needed to do and that I could get on the town hall meeting. So that was my question. What can be done about phone calls not being answered, no answer, no message, no thing to pick up? So therefore, that call has gone unanswered.
It was difficult for me to hear, but what I heard was people aren't answering the telephones. And
Yes,
what I can, thank you. Someone confirmed that for me. Thanks. So what I can tell you is that it's come up a number of times, and what I have discovered in the 100 days I've been here is that we are not giving you the right telephone numbers to utilize. And so we do have a patient scheduling center now that will answer your calls. Their phone number is the main line to the facility. I think it's 404-321-6111, and you press 2, it'll get you to the schedulers. We are fully staffed for them to answer the telephones, and then after hours, that number rolls over to a fully staffed call center that can answer those telephones. What has happened, and this is my opinion, again, I've only been here 100 days, is that there are a lot of phone numbers out there that aren't utilized any longer. And so we're working In fact, yesterday, met with the team about getting an updated roster on one point of contact per service, so that we can better communicate with the veterans. This has been brought up a number of times. In fact, Senator Ossoff brought up three things to me: fix the telephones, improve the access, and get ahead of the skeletons. And so fix the telephones was something that has been brought up a number of times. I think we're using bad extensions. And that bad extension leads to another bad extension, which leads to another one. And it's not acceptable. Right. So we need to get out this new number. The facility number exists, but I don't think we've told you guys to use that as the number to get hold of us. To answer the telephones.
Thank you, sir. I did, Mr. Call, Veteran Call, did you have another question?
No, that's it. I was just giving thanks.
Yes, sir. Thank you.
Mr. Cole, if you could let me know, right? If you call and don't get an answer through that, I've called and there's always been an answer, but we need to know when it's not working. So you guys got to let us know so that we can address it.
Yes, sir. Thank you.
Thank you.
Ms. Cook, we have a question in the chat. That question
yes,
comes.
Miss Frances Turner, if you could hold for a moment. I've been trying to get to meeting guest external with their hand up for the last 5 minutes. And so I don't want to skip over them because they had their hand up before there was a question in the chat. If you would like to unmute yourself, I'm trying to unmute you too. If you'd like to ask your question, meeting guest external number 2.
Yes, I would think that would be me. I'm going to go ahead and take a stab at this. I'd like to say that I have found that the complaint process is lacking independence and objectivity.
Thank you.
Somebody has an open mic. If you could just mute your mic until it's your turn, because it's causing interference for the person speaking. Thank you.
My question is, what are you doing to veterans who we don't trust the VA anymore? Like I said, I found that the complaint process lacks independence and objectivity. Thank you.
Yeah, that's a great question. Meeting guest number 2, sorry. What are we doing to build?
Hunt.
Say again?
Hunt, H-U-N-T.
Hunt.
Thank you.
No problem, sir. What are we doing to build trust? Well, there's an accountability in providing responses to the veterans. The VA has a standard of getting back to veterans and our stakeholders in 6 days, and I think we're down to about 3.25 days. So one thing is doing that quicker. There's absolutely nothing like providing a complaint, concern, or compliment and getting feedback swiftly. Our next step is to begin looking at the as a veteran, when I get care, I get a email sometimes that asks me 5 questions. It's a system that we have direct access to as soon as I hit enter and submit that survey. The next one is to begin responding to those answers for our veterans so that we can be even more timely with the response. What I make sure to tell veterans is that, again, I'm not the expert. Right, I have met with a number of veterans who sit down with me and ask me why they had left surgery, and I have to have the expert in the room with me, and I recognize it. Right, I know I'm the director of the organization, but I don't speak clinical, and I'm always going to have the clinician in the room with me to help guide that conversation and make sure we provide the best care for our veterans. I see a number in the chat that I actually recognize.
Some of them may be staff questions,
you did not answer my question. You did not answer my question, sir.
Okay. I see a 727 number that I recognize. I think that's like a Florida area code.
My question was that, one, the complaint process lacked independence and objectivity. And as a result,
I'm sorry. I think you cut off meeting guest.
This is Chief Veterans Experience Officer, Ms. McCrory. I'll be glad to call Mr. Hunt and have a conversation with him.
Oh, thanks, Ms. McCrory.
I've been waiting for that about 6 months now.
Thanks, Ms. McCrory. I appreciate you.
You're welcome.
All right, Ms. Frances Turner, I noted that Mr. Menser respectfully requested earlier that if there are staff on the call that had questions about payments, that we reserve that time, this time for veteran questions, but if they could ask those questions at an upcoming employee town hall, that would be preferred. If we have questions that are not related to staff needs in the chat, we can move to one of those. And then I'd like for us to move to the caller who has their hand up, who's had their hand up for a little while after Veteran Hunt had his. So, Ms. Frances Turner, take it away.
Ms. Cook, the question is, does the Atlanta VA have a veterans directed care, and when will it be initiated? Mr. David Carden. That's from Mr. David Carden.
We do have veteran directed care, but I'm not an expert enough to speak to it. So I'd like to see if there's someone else on the phone who might be able to help with that one. Kim's on. Hey, Kim.
This is Kim Whitmoyer. I am not our veteran directed care lead, but I am familiar with the implementation, and we do have a pilot right now that they are rolling out in a very small area in spinal cord injury. So there is more to come on veteran directed care, but we hope to have a couple of patients enrolled in the next couple of months. So.
And Ms. Cook, this is Dr. Hampton. Mr. Carden, if you don't mind, you can give me a call or send me a message and we can discuss it. Thank you.
Thank you, Dr. Hampton. And I did just check, the next employee town hall is scheduled for October 24th. So it's every other month, roughly, depending on schedules, but October 24th is the next employee town hall. So again, respectfully, employee questions will be answered during that forum and not during the one for veterans. I still am trying to get to the caller. That's 727-992-1662. You're free to ask your question at this time. Thank you.
Thanks, Chanel. For the staff that have questions, you don't have to wait till the town hall. And you can begin asking those questions beforehand. You're not limited anybody. Who is that? Somebody from Florida. That's that 727 area code.
Right, but for some reason, every time we unmuted it, it's not working. So I'm not sure what's happening. I keep unmuting it, but I can't hear anyone talking.
Okay.
In the interim, if we could move to Whitney N. Flemister or Flemeister, you're free to speak and ask your question.
Hi, this is Whitney Flemister. I'm one of the social workers in the Bronze Clinic. So a lot of my, questions or concerns in reference to the geriatric patients. Transportation is always an issue for the veterans. I don't know if it's feasible or possible to have maybe transportation clerks assigned to specific clinics as opposed to a centralized system, especially maybe for certain specialized groups of patients. We're kind of growing in the Bronze Clinic, a lot of transfers. So our panel size is supposed to be maybe 3,000 or so veterans. We're only at 1,000 or so and growing as they shift those patients from other clinics to Bronze. And a lot of those patients have a lot of needs and very complex. And so transportation being one of them, it would be beneficial if we had someone that kind of focused specifically maybe on that particular group. Another question or concern, just more focus on geriatrics patients coming to the hospital. They may get transported there, but having them to be identified in some way upon arrival to have the escort to be able to get them to where they need to be. And then also I know other VA locations, I'm not certain that we have this, but they have certain designations in reference to geriatric care. And I don't know if the Atlanta VA has been designated. I'm a newer employee here. Not super new, but newer compared to some people. And so I just wanted to know if there was any interest or intention on having our facility designated with those geriatric seals to provide certain care to the veterans.
Thanks for the question, Whitney. For veterans, I don't know the answer to it. We might have some folks on the call that can help provide that. And if not, maybe something we can follow up with offline. It's chair to 48 as well. But I appreciate your advocacy for the veteran, Gary. That's one of my priorities.
All right, I'm hearing a pause, so if we could move on. We've tried to get this caller in, but we have maybe some bad connection. 727-992-1662. You're free to speak and ask your question at this time.
Chief Cook, I'll reach out to the veteran.
Thanks, Mr. Corey.
Thank you, Ms. McCrory. I'm checking the chat as well. Ms. Francis Turner, do we have any additional questions at this time?
Yes, we do. From Miss Veronica Waldire, is the call center VA employee or are they a contracted fulfillment company to include rollover?
So we have the first number you dial, that main number for us is actually the main line to the facility. And then, there's a lot of jargon that comes in, about suicide prevention. And then, if you want to press 1 to fill your meds and then press 2, which is the option I'm recommending to schedule. If you don't press a number, it'll end with an operator. Those operators are contracted staff. And the contracted staff will receive, they have one now, but I think it's an outdated call list of extensions for folks in the facility for different clinics and services. So that is part of the desired outcome, is to give them that new call roster so that they have an updated list. And I'm advocating for not people's names, because as soon as we give a name, that person gets a promotion or another job, and then that person's the wrong person. And so then we get back into the same cycle. So I'm advocating for positions. So, primary care, mental health, social work, right? So that if somebody needs to get a hold of somebody, and the second thing we're advocating for is that if you're going to try to get a hold of Ms. Whitmore or someone in social work, that it's not just one number. It's a number that rolls over to another number in the absence of somebody, or a voicemail, and then asking them, demanding them to respond to voicemails in an appropriate amount of time. So there's a lot that goes into it. If you press 2, that is our staff here at, I believe they're all virtual, but it's here at our medical center. They report to us. And we've got great rates right now. Their speed to answer is less than 30 seconds, like 99% of the time. Their ability to answer the call and solve the issue, schedule, or resolve is less than 5 minutes, and the national goal is 6. And that depends, right? Some veterans like to talk more than others. And the abandonment rate is really, really low. It's somewhere less than 4%. And that's like a veteran who changed his mind or her mind and calling us and or didn't want to wait long, in the 30 seconds, right? And that's how long it takes, less than 30 seconds to answer the phone. So we're monitoring that every day now to keep up with this call center, to see if it's appropriately staffed and to see how they're doing their jobs. So that's why we're using that new telephone line. Great question. I think that was early.
Yes, internal. Did we have any other questions, Ms. Francis Turner, in the chat?
Not at this time.
Thank you for that, ma'am. Do we have any additional questions from those who are in the audience virtually? Feel free to raise your hand. If you can't raise your hand, but you can unmute, feel free to ask one at a time if you have any additional questions of our executive leadership team and support staff today. I see the initial V for Valerie. Please feel free to speak.
Hello, are you guys able to hear me?
Yes.
Yes, ma'am.
Hello. We are a provider. We kind of assist the veterans from the Atlanta VA, the senior portion of it, the geriatrics. And I noticed that we have, well, according to the director over there, that it's kind of backed up. And I wanted to ask, are you guys have any focus or any updates on if you have a backlog over there? Because we're ready to assist the veterans in any way that we can.
this is why I struggle with the virtual. I think that Mr. Turner had brought up the in-person is much easier, I think, to understand. I'm not sure that I understand the question.
What kind of
Yes,
care
sir.
provider are you, ma'am? You said senior geriatric. Can you provide a little more detail that might
Yes,
help
yes,
answer the question better?
yes, ma'am. And I do apologize. I definitely don't want to confuse the homemaker program. Were you able to hear me?
I heard
Yes,
homemaker
ma'am.
program. I was looking for, I think, the question again, though. I just don't
I
understand.
can get her information and follow up to find out exactly what it is she's looking for. Miss Valerie?
Does that work for you,
Yes,
Valerie?
ma'am.
Yeah. Okay.
Yes, ma'am.
Okay.
Thank you. Again, sorry for the virtual. At least we're having it, but we'll do it in person as much as in,
My information is in the chat, Miss Valerie. It's
Okay,
Gwendolyn Ramos.
Miss Ramos. Oh, absolutely. Yes, ma'am. I do have it, and I have your number that you put in there. Thank you.
You're welcome.
I see another question in the chat from MD. Surveys. I received 2 last year. Both listed doctors that were not part of my treatment, and there was no indication of what the service was on the survey. What are you doing to ensure the accuracy of the surveys that are sent to veteran patients?
I think Ms. McCory might have to help with this one. This is the
Yes.
patient
But my
surveys.
apologies for that. We don't control the surveys that are sent out to the veterans. They're based on the visits that you've had within a certain amount of days. But if you receive a survey and you didn't have that visit, you can feel free to contact me, and it could be a SHEP survey or a Press Ganey survey. And you may
Ms.
reach
McCrory, while we have you, would you mind expounding on what those 2 surveys are and why they exist?
the surveys exist because we want to get an idea of the patient's experience based on the questions that are on the surveys. The surveys healthcare patient experiences, and then the press gain surveys are much more aligned to the hospitals in the community. And it's an opportunity for the veterans to elaborate on the services that they were provided during their visits. Okay. Well, I was going to say to the veterans that's calling, they will reach out to me at extension 205900. I'll be glad to look at the survey they received and the services or the provider that they had a visit with during that time.
And someone had a follow-up question. Do we know if VA is going to move to digital surveys?
Not sure. I know that they have the opportunity to call and via email. Okay. I'm not sure what they're looking for. I asked them. But they do have the opportunity to do it via email or over the phone.
You know what, Whitney, I think it's a great question. I'm pretty involved in the VA, and I have not heard conversation about this, but next week, we're going to have an expert from central office who oversees the Office of Patient Advocacy here. And so I will write it down to ask her that question. I get it. We shouldn't be answering 26-page questions and mailing them back to the VA anymore. We live in the digital world, and we should be doing it virtually. And so I'll make sure to bring it up.
Thank you, sir. Next.
Yes, sir. On the veterans experience side, NIO side.
Yes, ma'am. Thank you for that information. I see a hand up from Miss Belinda Boldo. Miss Boldo, did you have a question, ma'am? All right, I'm not hearing anything, but if I'm missing it due to connectivity, someone please let me know. I'm going to a question in the chat. Looks like it is also internal, potentially a staff member. What does the mission of the VA mean to you?
I mean, it's simple to me, really. The VA's mission is to care for our veterans. And I have said this before, but it might be oversimplified, but I think as a veteran, I want to get better when I come here to the hospital. I don't want to get sicker. I want to that's in, I want my care to be timely. So if I get a sinus infection, I want to be seen that day. If I have an appointment that clinically makes sense in 30 days, I want to be seen in 30 days. And
Oh, so funny. That is so funny.
if I can't be seen in that amount of time, I want to be able to go to somebody that can care for me. And then the last thing would be that while I'm here getting care or in the community getting care, that you're nice to me. And I don't think you could ask for a whole lot more than that. And it better be qualitative care, right? So again, that goes back to, getting better.
And Ms. Cook, if you don't mind, this Dr. Hampton. You guys know we had we still have the somewhat modified Lincoln promise, which was to fulfill, his promise was to care for those who have served in our nation's military and for their families and caregivers of survivors. And so to me, being the wife of a military veteran and also being a daughter of a Vietnam veteran, it means that while I'm here on station along with our medical center director, that I will ensure that our veterans get the best care possible and be available to our veterans and put the veteran at the center of everything we're doing. Thank you.
Thank you, Dr. Hampton. I am just double checking for the good of the order. Do we have any additional questions from our guests today? I'd like to note that I think at our highest today, we started out at 231, and right now we're down to 197. So that's an excellent turnout. We thank you. We understand that the weather didn't show itself friendly today. However, we are here virtually. We are going to be back in the office, everyone, hopefully safely next week. These veteran town halls will be held quarterly. We're going to get the schedule out for next fiscal year, no later than the end of this week, or excuse me, next week. Just have to make sure we've got leadership available and staff members as well to support in person. We will move them back to the Pete Willer auditorium, and we will welcome you in then. And then please, if your schedules allow, please attend the events that are noted on the facility's main website. I'll add a link to the events page in the chat. And until the next meeting, you are welcome to visit us in person. Call the numbers that have been provided, and if you have direct points of contact, staff will do their best to assist timely. If we don't have any more alibis or outliers, sir, I recommend that we close for the day.
I agree. Thank you for coordinating this, Chanel. Appreciate you and your team. Ms. Nefori, I appreciate you getting on and to help support this with these great skills. And to the veterans that have attended today, I appreciate you giving us some of your time and helping us to provide better care for you. And look forward to the next one.
Thank you, sir. Be safe, everyone. Have a good weekend. Bye-bye.